Welcome back, guys, to another episode of Hormones Happen. I have a very special guest with us today. She is a board-certified nurse practitioner with an extensive background in emergency and primary care, and now the owner and operator of E&O Wellness. Natalie, thank you for being with us.
Of course. Thank you so much for having me today.
Natalie, I have a question. What inspired you to start a DPC practice instead of a traditional insurance one?
Kind of a long story. So, kind of how I decided to go off on my own was I was in a provider meeting with my corporate job, and they had told us that our hours were going to change. And I had come from another corporate position, and I just kind of sat there for a little bit, and I was like, I just don't think I'm ever going to get what I really want out of corporate. And so I went home to my husband, and I was like, I think that I want to go off on my own. And he was like, do it. So I quit my job in May. I spent the entire summer transitioning into my own practice, figuring out what I wanted to do. And I worked with a company, Oma Health, to help get my business up from the ground up. And they have been amazing to work with and taking care of everything on the back end that is so over my head. So what led me to open a DPC versus a traditional primary care was I got denied by insurances.
Sure.
I submitted all my applications and I came back and I was sitting and just kind of waiting around, didn't really hear anything. And right when I was like getting ready to move into my suite, I got noticed that 3 out of like the 6 insurances that I applied for denied me. And I was like, okay, well, I have to start. And I'm maybe kind of biased. I see a DPC, my kids and I do, and I absolutely love it. And so I connected with my doctor, kind of got, a little bit of information about how she structures her practice. And I just kind of went with it. And I haven't looked back since.
Isn't it funny how sometimes life just has a way of telling us where we need to go, even though that's not where we were intended to?
100%. Yeah. I didn't expect to hit those kinds of roadblocks. I had every intention of, kind of doing like still kind of incorporating like the DPC route. Like I still wanted every single appointment to be like at least 60 minutes with my patients to ensure that I covered everything. That's why I opened my own practice. I don't want to do 20-minute appointments anymore where, like, oh, by the way, like something else came up. And it's like, well, I don't really have time. Like that's just rude in my opinion. So I still kind of
Absolutely.
wanted to incorporate both, but I was unsuccessful with doing that, and so I just decided to go the DPC route. I my membership is $80 a month, but I did it that way because when I compare myself and I look at the bigger picture of the other DPCs in my area, I do offer more services that are just not only to primary care. I also do regenerative medicine. I also do Botox, and I don't limit patients. So you don't have to be a member of my concierge service to do any of my other services here in my office.
That's very cool. Do you feel like your background in emergency medicine helped you to get those additional services like your PRP injections, your Botox? I mean, you feel comfortable with a needle.
I, I definitely feel comfortable with the needle. Yes. I loved, just starting IVs, in the emergency room. That's a skill that you have to be really good at. I didn't actually get into regenerative medicine until I became a nurse practitioner. And that was actually my first nurse practitioner job. I worked in a regenerative medicine clinic, and I really liked it. Uh, I just kind of felt like as a new grad nurse, like I kind of think like everybody goes through this. I was kind of like, I think I need to like just gain a little bit more experience. Like if I ever wanted to like go back into the emergency room, like I want to be comfortable knowing, my medications and broadening my scope. And so that's kind of why I transitioned into primary care, and then I just never really left. And then when I opened my own clinic, I was like, I'm going to do it all because I
Yeah.
can. I know how to. Really, really missed doing PRP and I did a little bit of aesthetics I on the side, but I wasn't too active until I started my own practice.
And for those at home that are unfamiliar with what a DPC practice is, can you just tell us a little bit about it?
Sure. So concierge style practice is most appointments I'll say are 60 minutes long. You pay a monthly membership fee. I Describe it as like a subscription. Like think of it as like your Netflix. You can watch as little or as much as you want. You probably won't get popcorn here. You probably won't get popcorn included with your Netflix subscription, but it's unlimited visits that are all 60 minutes long. You can see me, as little or as much as you want. Unlike the traditional corporate medicine where, you message your provider on the portal and it's like, hey, I'm sick. And they're like, oh, well, you got to come in for a visit so I can bill you. That's not how this is over here. You get sick, I treat you right away.
Yeah, the flexibility is absolutely phenomenal. And we do the same model here with the hormone clinic. We're a very concierge white glove service. So our patients are only a text away, they're a call away. And they know that and they appreciate that because in the traditional insurance based medicine world, well, guess what? You're 3 months out for a small little thing that can be taken care of immediately, guys.
Sense. Yeah, I completely agree. And I think medicine is, with all the changes to insurance coming up and the things that have happened, it'll be really interesting to see what happens in the next couple of years. But I do really think that this is the way medicine is going to be going.
I agree. And like, how do you feel like you made a TikTok once that I absolutely loved? I think it was like why 7-minute appointments with your provider isn't enough, right? And it really encapsulates that when you're being seen by a clinic who takes insurance, and I have a lot of friends who do this, you're getting inundated with patients. Patients are being sent to you all the time. And how can you see 30 plus patients a day and spend any amount of time with them? What are some of the benefits to being able to have more time with these patients to actually kind of flesh out some of their issues?
It's been so nice. I've had a really decent following of just my patients that I've taken care of now for, over 3 years. And I have just been able to like sit down with them and be like, hey, we're doing a thorough family history. And I have learned so much more about my patients that I don't think I ever would have known had I, worked in the corporate. I was just, filling their medications because they've been on it for so long until I like I started my own practice where I knew I had time. I knew I had an hour with them. And if it went over, I went over because, that's with the flexibility. You can, call and text your patients, be like, hey, I'm running a little bit behind. Like, can you, come in like 10, 15 minutes later? So I am just like super grateful that, time just means everything to anybody. Even if you take just the extra 5 minutes of sitting with someone, it might be someone's worst day of their life, and they just need someone to just sit there and listen. And that's the difference of a provider wanting to explore the other avenues of especially concierge service where you can give that time back to your patients.
Right. Time to actually be heard, right? Because oftentimes, patients just feel like they're just talking and they're never being heard, right? The patients don't care what you know until they know you care. And that's the reality. That's any one of us.
For
If you're
sure.
talking to someone about some of your major pain points, your major issues, and they're just discrediting it like, okay, yeah, sorry, sorry, sorry. Yeah. It doesn't do me any good. I want to be heard. I want to have a good dialogue. I want to talk to you as a person, and I think that that's one of the biggest factors of burnout in healthcare is that we're trying to give as much as we can to someone in such a small amount of time that it's just impossible because we can't give the care that we want to, right? And that's
Right.
why we all got into healthcare to begin with, is to help people.
Well, and I have to kind of ask you, with you starting your own business and going the
Mhm.
hormone and weight loss route, do you find like with like your patients that you have in your clinic that like they were like discredited by their primary care provider and like that's why they kind of ventured out to come to you?
Yeah, all the time. And, this is the thing. I don't like to put the blame on primary care because having been there, I know how difficult it is to treat
Absolutely.
something when you know how you can't. Your hands are chained. Not to mention, believe it or not, there's no formal education, whether you go to medical school, NPPA, you don't get that training. Okay. So
100%.
I always tell them it's not your provider's fault. I understand. But when we'll take a woman, for example, goes in and says, hey, I'm not sleeping. I have no energy during the day, no libido. I'd like to get my hormones checked. And what they hear is, welcome to the club. That's normal.
Yep.
This is menopause, right? Like that is the most invalidating, upsetting thing you can hear because something's wrong and
100%.
they know something's wrong, but guess what? We're not going to do anything. And I see it all the time, right? Myself included. When I went to my primary and I asked to get my hormones checked, she's like, you're 33. What do you mean you want your hormones checked? Like, are you crazy? And it's like, it was just always a very uncomfortable situation. And so, yeah,
For sure.
absolutely. I think that just being discredited in general sucks, and I think when patients have that happen to them, they not only lose trust in that provider, but in the whole medical system. Like, they're out to get us, right? And that's not true. And what I really love about the DPC model is that the flexibility, right? Because people say, why do I want to pay monthly when I have health insurance? But what people don't understand is all the red tape that comes with insurance and the availability that we can do. People don't know, hey, I can actually pay out of pocket for a lot of this stuff. People don't know this. People don't know I can pay out of pocket for imaging. I can pay out of pocket for labs. Now, granted, sometimes, I think you use insurance too, the patient's insurance for labs and stuff
Yes.
too. Yeah.
Yes.
So it's there. It's there for a reason. I do it too, but sometimes you can get cheaper prices for imaging for labs with
Absolutely.
cash. So you always got to look. You always got to look and do some cost analysis and compare things. But, what kind of things can a patient expect from a DPC model versus like a traditional insurance care?
I think that, the major difference is, it just comes down to quality of time. If you really want to, not make 6 doctor visits to talk about, 3 different topics because like you're out of time in like your 20 minutes, like we have time in a DPC to go over the things that need to be addressed. I mean, obviously, you and I have primary care and ER experience, and it's very difficult to find time in those environments.
Absolutely.
I went from seeing 16 people a day to seeing 6 people a day, and people are like,
Yep.
"Oh my gosh, like, that is insane," and it's like
Right.
but it is so nice because I'm able to really turn my brain off when when I go home from work because I got through everything. I know that I'm not gonna come to work with with an empty task bucket leaving work and then come back to like 80 tasks the next day that I'm going to have to go over. It's mentally and physically and emotionally exhausting. And I feel like I can be a better provider as well because I am rested. Don't need to carry things over like day to day. I spend so much time with my patients and and I think that that's what like healthcare needs to be. It just needs to be fun. People should want to come see their provider because they want to feel like, okay, I have a checklist and I want to check everything off. It shouldn't feel like a chore.
You're right. This is a right that we should have. I'm a huge advocate for the patient should have some say in their healthcare. You should
Absolutely.
have say in what your healthcare looks like. And too often, it's almost kind of like a dictatorship, not a decision making process where they're just being told, hey, you need to do A, B, C. And it's like, well, sometimes what I like to tell the patients is you're in the driver's seat of this bus.
Mhm.
I'm in the passenger seat giving directions. I may say, hey, let's go right. You say, let's go left. If you could tell me why we should go left, okay,
For
let's
sure.
do it. Let's try it, right? Like, as long as it doesn't hurt someone, I'm on board because at the end of the day, no one's the same. And granted, we have studies and we have all this literature, but it doesn't encapsulate everyone. And there's always, I don't want to put my tinfoil hat on, some agendas and biases and whatnot. So the reality is everyone's different.
Absolutely. I precept a lot with nurse practitioner students. It's difficult, coming out and you're like, "Oh my gosh, they trust me to like do this?" Like, I
Yeah.
feel like I know what I'm doing, but like I don't. And like the first year of being, I'll speak for myself as a nurse practitioner, it was super nerve-wracking because, I'm like, "Oh my God, like I'm like in charge." And so, the more that I've like, obviously established like, myself in practice, I really go into my patients saying like okay and teaching my students like pick your top to pick your top 3 medications, your top 3 antidepressants, your top 3 blood pressure medications, and I was like and have rationale and know why you prescribe them, what they do, and educate your patients like hey, these are the couple different avenues that we can go down. What do you feel is going to be best? I can give you all of the information that I know, all of the experience that I have seen. But I mean, ultimately, it's up to you. I always tell my patients, like, you're not going to hurt my feelings if my first choice was like the worst option out there for you.
Right.
Like, oh my God, Natalie, I felt awful. I'll be like, I'm so sorry. Now we have plan B's and C's. Which one would you like to go with? And
Absolutely.
you do need plan D and E and F.
Hey, exactly. Some people do, right? And so the reality is with insurance, there's always these flow charts, right? There's always these algorithms. And so you don't get that ability to make these decisions. You're stuck with doing this. If it fails, you do this, then this. And so you don't get to make these higher level decisions. They're made for you. And really, at the end of the day, what I feel like getting out of my medical training was I was a prescriber. So diagnose, prescribe, diagnose, prescribe. And that got so mind numbing. It was just absolute burnout central.
For sure.
And primary care is the most important specialty. I consider it a specialty that there is. It's the catch all. You're going to see something before any specialist does, and you have to have some degree of understanding on it. You wear all the hats in the world of
Absolutely. I
medicine.
always say that, like, being a primary care provider, you have to know a little about a lot. You don't
Yeah.
have to know everything, but you do have to have some kind of information. I always, again, like tell, my nurse practitioner students, like, you are not expected to know everything. Someone's not going to come to me if they have heart issues. And if they do, like, we're going to go to the specialists that need to be involved. I'm happy to get you there, but you don't want me to, be that person.
Yep, yep. And that's the way I look at it. I stay in my lane. When there's a primary care
Absolutely.
thing, I get them a primary care, right? That's the thing. I work with a lot of primary cares because the reality is I'm not it. I'm the hormone guy. And so what would you say, working in corporate America, some of the biggest shortcomings of our healthcare system regarding insurance is? What would you say some of the biggest issues you've seen with insurance-based care has?
I mean, not to throw, Cigna under the bus,
They know. They know what they're doing.
but I mean, as of October 1st, they passed a new policy that any provider that bills a 99204, 99205, or 21415, which, that doesn't mean anything to like our listeners, but that's essentially how providers chart. And the more time you spend with providers, the higher up the number goes. So, um, they're essentially saying that providers are abusing the system. They're not being truthful in their charting. That's going to cause a lot of turmoil. Like if insurance can't reimburse primary care providers, now there's another huge shortage that patients are going to experience because providers are like, well, I can't, just keep billing low things and making, and, or it's going to turn into, okay, well, now this person needs to make, an additional 5 more visits to talk about everything that they want to because we don't have the time to cover everything in this one session. And so it affects both people. And so, again, with the nice thing about DPC is I can take uninsured and I can take insured patients. Obviously, in the state of Colorado, it's, per Medicaid rules and regulations, it's illegal for Medicaid to see a DPC, or we could get sued because they want Medicaid to be covered under a Medicaid specialist or primary care provider because they want their services paid for, which makes sense.
Yeah, it's still very unfortunate though. You kind of get tracked into that level of care because the reality is
100%.
I've got a lot of patients who they don't even have insurance. They do all DPC stuff and they are very healthy people, right? These are the people who actually want to invest into their health. A lot of people look at health insurance like I have it just in case something bad happens. Whereas when you're paying that monthly cost, you are actually invested. You're saying, I want to take the best control of my health. I want to prevent any major complication before it happens. And
100%.
long term down the road, guess what? We're preventing hospitalizations. We're preventing significant amounts of money down the road with prevention, which I think should be the hallmark of everyone's mind.
Absolutely. And I'll just speak for myself. So, a little over 3 years ago, my mom passed away from thymic carcinoma, which
Sorry to hear that.
is just like like I think 400 people a year get diagnosed with it. It is so rare, this cancer. But when I went to my provider, I was like, there's not any research out there that shows that there's any kind of genetic component. But if you look and you look, like there's a lot of people that are so young that are getting cancer. And I'm a young person and I'm a young mom and I want to be there for my kids. And so there's not like guidelines to, do any kind of like protocol, like when you're trying to do prevention. And so I went to my primary care provider and I was like, look, I want a chest x-ray. And I was like, and I want a chest x-ray to make sure that I don't have a tumor on my
Good
thumb.
luck. Yeah.
And I know that, I think that if you have a provider that really cares about you, regardless if they're in corporate or DPC, they will provide that for you. But I mean, like there might be pushback. And so my provider was like, absolutely, we're just gonna get it done. Like, and she was like, and if you want to go like an ultrasound route, like every couple years, or you want to do like a CT scan, like she's like, we can figure out. We'll just make whatever prevention looks like for you.
That's awesome. And that's the biggest, I think people ask me, how do you know a good provider from a bad provider? And this is the thing. I'm never going to say a
I'm never
provider's
going to say that
bad.
there's
I'm
bad
not going to say
providers.
that, right? But what I'm going to say is that someone who listens, okay, it doesn't matter. I don't get too caught up. They may not know everything. I don't know everything. No one knows everything. But if they listen to you, they are already top tier. If they hear you, they listen to you, they can have a conversation with you, that's top tier, because that is something that I think is just fundamentally missing, is just being able to hear someone, talk to them, and then come up with a plan. We always talk about this in school, if you remember, joint decision-making process. But that never happens, right?
It never happens.
This is what it's going to be in education. There's no decision-making process. And so that's the thing. When you can actually start having the patient give you input on what they want to do, I love it. I always ask, what do you want to do? And then we go over the options, the pros and cons.
Mhm.
It's the best way to go through it because we're happy, they're happy, and they feel good.
That's what it all comes down to. We want everybody to feel their best. And how is that going to look for someone?
Walk me through. Let's say a patient comes in. What does it look like getting established with your practice?
So you usually sit down, I talk about my practice. So E&O Wellness, E&O is named after my two children, Ella and Otto. I sit down, I kind of go through a little bit of like my membership, what I do for patients. All my members get a 10% off any of my PRP injections, whether that's associated with like microneedling, joint injections, or hair restoration. And then I also offer a neurotoxin and filler as well. So I just kind of sit down, I go through that process, and I always ask, like, are you okay with proceeding with this membership? If someone's not, I'm like totally fine. Like I do offer like a one-time visit of $100 for patients. And more times than not, I feel like they do come back. I just want to establish care, and I'm like, great. But no one's gonna hurt my feelings like whatsoever. And if somebody just needs somebody to talk to, I will still do a visit. And everyone I feel like is always like, here, take my card, and I'm like, no, like, we'll do payment at the end. Like I'm not like that greedy, I promise. But I like to have kind of like a chiller environment. Like we can do as little or as much as anybody wants.
The name of the podcast is Hormones Happen. And incidentally, you do hormones, right?
Do.
Very cool. Very cool. How's that going? Is it pretty popular? Is it picking up for you?
There's a lot, obviously, as you know, there's a lot of hype around hormones. I don't ever stray someone away from checking their hormones, but I always do tell them, like, just depending on like your age, like this may be costly. And I always try to be as transparent as possible. Insurance may not pick this up. And more times than not, people are like, very receptive to that. I think it's a difficult field. I kind of want to learn first before I like go through with like my like answer. Like I want to know like how you kind of came up with this clinic that you own. Why did you pick hormones and weight loss?
Absolutely. And there are no wrong answers here. So I was working in the prison setting. Everyone's heard me talk about that ad nauseum. And I was so tired of being told how to practice. I was so tired of being told what to do and how to do it. And I thought there has to be a better way. There just has to be a better way. I wasn't feeling fulfilled by it. I was burned out. I had been doing it for probably about 4.5 years. I dreaded going to work. I didn't have that spark. I felt like I was doing a disservice to my patients. And so as far as hormones go, I've always been interested in hormones.
Mhm.
I've always wanted to get on TRT. My wife has always been like, you don't need TRT. And I probably did. But the reality is I always wanted to. And so in the back of my mind, it's always been like, that's something I want to look into. I used to have a bad misconception about testosterone. I thought it was harmful. I thought it was unnecessary. And in the primary care setting, that's what we're taught. So I did a lot of research, a lot of independent research, and I found out, oh my God, testosterone is saving men's lives. And I started out as just a men's clinic. It was Still City Men's Health and Testosterone. And one day there was a woman who called. And it wasn't unusual for a female to call for her spouse, but she was crying. And she said, I know you're a men's clinic, but can you please help me? And that's when I realized this whole time I've been focusing on guys, thinking that we're very underserved. That's when my eyes really opened up to women are the most underserved population that there is. There's no doubt about it. And so I just dove into research for women's health, women's hormones, and I actually treat more women than men at this point.
I'm not surprised by
The
that
name is Still City HRT and weight loss. And it has just been so incredibly rewarding. Just getting a text message from one of my patients saying, I finally feel normal, right? Like that just can bring tears to your eyes because you've gone so long suffering, saying, I'm not crazy. There's something wrong. And people are saying, your labs are normal. You're fine. Like that is the craziest thing. And so to finally get validation and feel good and actually know I was right. Of course you're right. It's your body. If you're saying something's wrong, something's wrong. And so, hormones, I've always kind of had a fascination with it. And then after I started hormones, same thing with the weight loss meds. I used to talk crap about GLP-1s all the time. I actually did some research, jumped on them myself, loved them. And so I'm like, oh my God, dude, this is amazing. So weight loss came, peptides, just all the new things. And I never say never anymore. I never say never. If there's something new emerging, let's see what it's about, And that's just my view on it. And so that's what kind of got me into the clinic is I was just so burnt out from insurance-based policies and procedures.
for sure. Is it like a regulation like at your clinic, like everybody has to get their hormones checked before they start hormone replacement therapy?
Yes. Yeah, absolutely. So we definitely get some blood work. And it's not just hormones. We definitely want to check
For sure.
CMP, CBC. There are some other markers too. But there are some providers who will say, hey, we just treat based off symptoms. I'm not going to say whether that's right or wrong. I don't think there's a wrong way or a right way to do it because 99% of the time your symptoms are enough, right? But the reality is sometimes having that validation,
Still need levels. Absolutely.
some kind of baseline, right?
baseline.
You get a little bit of a baseline and you can actually visually see this and have this discussion to say, hey, these are the things that we're expecting to happen because there are specific abnormalities you'll see on your labs that you want to be aware of before you see them. Otherwise, it's like, oh, what the hell? Like, am I dying?
Right?
And so, just kind of that pre-planning stage of setting the tone for how things will go, how we look right now, and the fact that we want to improve our overall metabolic health is important. So I always get the labs before, whether they get it through me, sometimes their providers will get it, and that's completely fine. Just as long as we have some recent labs within 6 months, I'm completely fine with that. But I do think it's a very important part of therapy.
I would agree. Absolutely. And like you said, just to at least get a baseline. And this is kind of where I feel bad for men. Again, kind of in like the corporate world, like, oh, you have to have 2 levels under 350 to initiate testosterone replacement therapy.
Brutal.
When someone who comes in and they're 36 years old and they're having difficulties with libido, that's not normal.
No, it's not.
And
It's
so
not.
it's kind of like, but then, you check their testosterone and it's like, I can try, but it's going to take a while. Like it's just such a like a defeating feeling for, again, like kind of like a provider that I will say cares. And then your patient who's just like, what am I supposed to do? Which,
Right.
you-
Suffer.
right? Exactly.
Yeah. Yeah, absolutely. And so the reality is with the labs, we're comparing an individual to these population-based labs. Okay. So we're
100%.
comparing you to the population.
Mhm.
I don't give a shit about that.
Right.
I'm comparing you to when you felt your best. And if you say, "Hey, I felt my best at 21, well, did you get your labs at 21? No one does, right?
No
Who
one
would?
does.
We get our labs when the wheels are falling off, and that's completely fine. So at that point, we have to realize we're not going based off these traditional population-based numbers. We're going off symptomology. because we want you to feel better. Frankly, I don't even like testosterone replacement therapy. I think optimization. Okay. I always say optimization. Is there a difference? I don't know. It's a different word. But the reality is, I always focus on improving symptoms and avoiding any negative complications that we can, right? I want to improve your entire life. I've seen marriages saved with this stuff. I've seen jobs saved. I've seen some really amazing things from hormones, both men and women.
Absolutely.
Yeah. And so with you specifically, like, do you feel the same way? Do you get labs first and then initiate therapy?
I kind of go, I'm like, I would say I'm like probably like 70-30. Sometimes I'm like, well, like you just had labs drawn like maybe
Yeah.
a year ago. Like, I don't think we like really necessarily need to change if like a year ago you
Not
kind
much
of felt the
changes.
same way. Like,
Right.
so I mean, again, I try to really just be like that provider, like, well, what do you want to do? Like, because
Yeah. I love it.
more times than not, like, I feel like in reality, healthcare can be so simple if you just sit down with your patient because your patient already has a plan. They have already, gone through their, Dr. Google
Hmm.
and
Yep.
figured out what they think that they need. And honestly, like, I don't ever promote Dr. Google, but I'm always happy to hear what, Dr. Google and my patients have found on their own research and what they feel is going to benefit them. So I kind of go back and forth. Um, I think that like I probably could be better like about checking like hormones like at a younger like individual, but it's hard to time it because if you have a girl that is young and she's normal on her period, it's like, well, like if you come in at this time like and this is happening, like I'm probably going to get like a false reading, so you really have to come in like on this day like specifically.
Right. Time their cycles. It's really challenging. Some people will say get at day 20, so you're in luteal phase. But,
Exactly.
you know, the people that come to me have already been suffering for quite some time. I don't feel like saying, hey, sorry, 20 more days. I'm like,
No.
it doesn't matter. And that's the biggest thing, especially with women who are still having their menstrual cycles. There are going to be periods of time where we expect those hormones to be high and we expect them to be low. I'd say that it's really better utility in someone who's postmenopausal because then we can actually see these numbers and explain, these are where your numbers are at. And these are some of the harms with low estradiol, for example. But when you're still cycling, it's hard to say. We could be getting high enough. We don't really know where you're at,
Right.
but that's where the symptoms come in. Because if you're still having symptoms, I don't care what that piece of paper says. But,
100%. Yeah. At the end of the
at the
day,
end,
it's just like look good, feel good. And
that's what I was going to say. Yep.
I and maybe you can like, kind of talk about like your experience with this. Like I kind of think that like there are some certain times when I've had to have like, okay, we need to have a come to Jesus talk because patients all, once you feel good, like, and you're like, at like 80%, like you want to get to that 110%. And like, that's just not realistic. And I always kind of like compare it to like, being blonde. Like if you're blonde, like you're never blonde enough. You always want to be blonder, like because you see that girl with like the silver hair walking around, you're like, oh my god, like I need to have like that white hair.
Yep.
Like,
Is it true though, Natalie, that blondes have more fun?
of course, yeah. I don't know otherwise, but I just
Yeah.
assume so.
Yeah, but you're right, more is not always better, and that's, I think we're all a victim to that. If a little bit's good, more must be better, and that's not always the case. I see this happen all the time. I'm a prime example. I treat guys with my TRT all the way up to 280 milligrams a week, which is very, very generous. Traditionals of like 200, okay? Did it myself. I was at 280 for probably a couple months. Acne was a bitch. I
Mhm.
came down. I feel better at 210 milligrams a week than I did at 280. Okay. And that's a prime example of thinking more must be better. It is not. I feel mentally
100%.
better, physically better, and I'm not having the acne. So that's just one example. What sometimes guys will, and this isn't so much with women, I feel like it's more with men. They will have this misconception that this testosterone is going to make them to where they never feel sad. They never feel mad. They never feel any emotion. And it's like, it's not a panacea to all your problems.
Right.
It's an incredible tool, incredible tool. It's a horrible crutch. And you're still going to have struggles through your life, but it is going to help you more efficiently navigate them. So
Absolutely.
expectations are mandatory. You got to have realistic expectations. You got to have some type of goal in mind of what you want to achieve with therapy. Because if you come in nonchalant and say, well, I don't really know what to expect, let's just see how it goes, That's a horrible plan. You really want to have some ideas of what am I looking to improve upon? What are some steps I'm going to take outside of just testosterone to do them, whether that be lifestyle change, exercise, diet, whatever, marriage counseling, and incorporate the two. That's the perfect way to incorporate hormone replacement therapy for a man or a woman, in my opinion.
Like, oh, and I really love that point of view. I always kind of tell patients, like, especially kind of starting like really any kind of regimen that's going to benefit them. I always say it's kind of like a 33% rule. You have 33% like of medications that are going to help you. 33% is going to be your exercise, and 33% is going to be the food that you eat. But they all have to work together. If you do one third of that, you're not going to feel, as good as you would if you maybe did like two and a half thirds of it
True.
or the whole, or
100%.
the full
Mhm.
100%.
You still got to put in the work no matter what. There's no pill yet that you can just take and
Right.
stop working. You always got to put in that work.
If that
Now,
existed, I'd figure
oh,
it out.
I would take it in a heartbeat, a heartbeat. Now, do you also do telehealth?
I do.
Oh, perfect. Do you practice in any other states than Colorado?
I don't, just Colorado.
Are you looking at other states?
It's been on
I'm
my
sure you will.
radar, but I'm not sure. I don't know about that yet.
Sure, yeah, absolutely. You got to get your feet wet. This has only been a month in. I mean, you're still like, man, this is it, and that's exciting.
Yep.
That's so exciting. And so, one last parting thing before we leave: if there's someone who's kind of on the fence as far as like, I think the DPC model is right for me, but they're just not 100% convinced. They're not 100% sure. What's something you would tell them to put their mind at ease that the DPC model is a fantastic method of primary care?
I kind of just spin it a little bit on the patient. Like, what do you look for, like when you go to any kind of appointment? Like, does appearance matter? Because nobody wants to walk in or have their doc or their provider walk in who looks like really disheveled and like super tired. You're kind of like, it's gonna be a good visit. So I think, like, as superficial as that is, like, people want someone that, is going to always, kind of look and feel their best. And I think that energy really matters. Like, if you don't get like a good vibe with someone, like, you're likely not gonna come back. So I think that it's kind of more like a reflection on like the patient's, like, what do you actually look for in a provider? Who do you feel is going to, sit down with you and discuss all the things? I actually have a new patient coming in today who was emailing me. She's like, I just have a couple questions. Like, what's going to go on in this visit? She's
Mhm.
really want a physical. And I'm like, if you want a physical, like, we will make time for the physical. But I do also do like a get to know you. And, I always like to kind of have fun with my patients. Every single patient that walks into my room, I always say, tell me some fun facts about you. And they are always like are kind of like caught off guard, like, what? And I'm like, tell me where you're from, like what you like to do for fun. Like, and it's kind of just like my little icebreaker that I just incorporated because, like, and it's the same thing as just like asking someone like, their name. Do you go by that? And if they're like, no, like, oh my gosh, like, like I've been coming to like this place for like 20 years and like nobody's ever like asked me if I go by a different name. And I think that, just for my personal experience, like that's how I function. Like I want to be friends with my patients. This isn't like, like you came to like the principal's office and like you're in trouble for
Right, right.
you're like, this is supposed to be fun. Like, let's just work together. And again, like, you get an hour visit with me. And if we need to, if you need to come back, guess what? You get another hour.
I love that. I love that. So, guys, I'm going to have all of the contact information for Natalie in the description. So, if you're looking for a DPC practice, a really good provider, Natalie has you covered. Natalie, thank you so much for joining us.
Thank you so much for having me. This was so fun.